All right, so let's go over some frequently asked questions about the hip. Now, when I sat down and reflected on the most frequently asked questions that I get from physical therapy clients, from those on my Operation Human First online platform, from my Kinstretch students, and those on my Instagram page, by far the most questions that I get are related to FAI and hip impingement and closing angle pain in the hip. So I put up a poll on my Instagram page because I wanted to make sure that I wasn't missing anything. And I asked you guys, what questions do you have about the hip? And you basically confirmed that about 70% of your questions are related to those topics. So we're going to spend a decent amount of time covering that in this video. So let's go over what FAI is first. FAI stands for Femoral Acetabular Impingement. Now, the femoral refers to your femur, which is your leg bone, which comes up and makes the ball of your ball and socket joint. Acetabular refers to your acetabulum, which is a fancy name for your pelvis, and the socket of your pelvis. So your pelvis makes up the socket of that ball and socket joint. So we've got femoral acetabular impingement, meaning the two literally impinge on each other. So what happens in FAI is that you get so much stress from things kind of being congested and running into each other. In other words, closing angle pain starts to go on for so long, and we get that pinching for so long that we actually start to develop some bony growth or some growth. Now we can get that growth on our femur or on our acetabulum or on both. So we can get it on both at the same time or have any combination of those two. And then where the bony growth is will dictate what type of FAI it is. So we've got CAM, which refers to the growth being on the femur, and we've got pincer, which refers to the growth being on the pelvis. I just want to stop right there and say that this is a really good example of why we tell you guys all the time, do not push through closing angle pain. If you keep doing that over time, you can actually start to cause really unfavorable changes to your joint, to your tissues, and we don't want to go down that road, and FAI is a good example of that. Now, I actually had one person ask me a question on Instagram that I've never been asked before. And I don't know your name, your Instagram handle was BK something, so I'm just going to call you BK. But he asked, why is the FA diagnosis so controversial and often mismanaged? Now, I did want to touch on this question. When it comes to it being controversial, I'm not sure specifically what you're referring to. But one thing that I've noticed myself is that often we'll get people arguing, one side saying you can't get rid of FAI without surgery, and one side saying you can get rid of FAI without surgery. And I think a lot of that comes down to miscommunication in that if you're asking the question, can you get rid of the bone growth without surgery? The answer is no, you can't get rid of the bone growth. But a problem or a common problem is that people assume that because that bone growth is there, that that person is going to have problems, is going to have pain. And I've seen it many times where people have that bone growth there, but when you rehab them appropriately and conservatively, they actually don't have any problems with it. So it's then not necessary for them to go get surgery. It kind of depends on what question you're asking. If you're asking the question, can you get rid of the bone? No, you can't. But if you're asking the question, do I need surgery because I have FAI? You might not. And in fact, there's a good chance that you don't. To date, I actually haven't had a single client come to me with FAI that has needed surgery. I have had a lot of people come to me that had FAI, went and got surgery, tried to rehab it, and either came out with the same symptoms or worse. So, I mean, it's one of those surgeries that I think gets done too frequently and that I think people jump to too quickly. And in terms of controversy, that might be a source of controversy in and of itself, in that some people still think it's a surgical problem. Some people think that there's a good chance we can rehab this without surgery, just conservatively. But like I said, once you have that bone, you can't get rid of the bone without surgery. But that's not to say that that bone is going to cause you problems. What you want to do in that instance is make sure that you stack as many cards as you can in your favor. So you want to make sure that your breathing is in check. You want to make sure you can develop good intra-abdominal pressure. You want to make sure that you can stabilize that pelvis. You want to make sure that you have really good rotational capacity at the hip and a really good hip capsule. And again, for all of these things, like best case scenario is that you go get assessed and you find out what your limiting factors, what your deficits are, and where you have room for improvement, so that you can kind of fast track things and figure out where you're going to get the biggest return on investment in terms of spending your time. But know that there's a lot of things that you can work on to help to stack your cards in your favor to overcome this FAI being a limiting factor for you specifically. When it comes to closing angle pain, hip impingement, hip pinching, again, the same rules apply. So you actually want to make sure that you're checking the same boxes. So the same ways that we are going to take somebody who has FAI and try and give them the ability to do what they need to do and have really good mobility and access to their hip without that hip pinching, those are going to be the same strategies that we'll use to help make sure that somebody's hip pinching or hip impingement doesn't turn into FAI, or that somebody's closing angle pain starts to actually resolve so that we no longer have that closing angle pain, closing angle restriction, or closing angle pinching. So once again, that brings us back to things that we talked about earlier, which is your breathing, your intra-abdominal pressure, and your hip capsule. Making sure that that hip capsule is in check, that it's really good quality, that you've got enough space in your hip joint or capsular space. So that brings us back to rotational work, internal rotation, external rotation, all of that kind of stuff. So I made a point of putting some resources in this document for you. You've got the hip cars. Make sure that you keep them pain and pinch free, so detour around any painful ranges of motion, not through them. You've got internal and external rotation setups and stretches that you can use to start to work on hip internal and external rotation. You've got the information on breathing, and again, if you want to learn more or you want more resources to help improve your hip mobility, hip rotational capacity, hip capsular health, you'll find all of that stuff within Operation Human First as well. And it's always important to mention in these instances that if you have FAI, it is well worth going and getting assessed and finding a professional that can tell you where you will get your biggest return on investment based on your assessment. If you don't have a professional in your area that you know or you trust, or you don't know if there's anybody near you, I'll include some resources in this document as well so that you can help find somebody to work with.